Hello everyone and welcome to today's webinar, ANM Changing Role, primarily a midwife to a preventive health worker. My name is Professor Dr. Ratnachaya Singh, Dean of Nursing Education, Mansarovar Global University, Bhopal. I am excited to be hosting this session today. And this webinar is organized by Mansarovar Global University and Nursing College. तो आज के टॉपिक ऑक्सिलरी नर्स मिडवाइफ के चेंजिंग रोल के बारे में चर्चा करने के लिए हमारे साथ गेस्ट स्पीकर प्रोफेसर डॉक्टर एमएस विंसी मैम हैं, जो कि प्रिंसिपल बॉम्बे हॉस्पिटल कॉलेज ऑफ नर्सिंग इंदौर से हैं। मैं यहाँ पर उनके बारे में आप सभी को कुछ जानकारी देना चाहती हूँ। आप साइकेट्रिक नर्सिंग से एमएससी तथा पीएचडी नर्सिंग हैं। आप काउंसलिंग एंड साइकोथेरेपी में पोस्ट ग्रेजुएट हैं, साथ में एमए सोशियोलॉजी और एमबीए हॉस्पिटल मैनेजमेंट है। आपके प्रोफेशनल मेंबरशिप के बारे में बात करें तो आप मेंबर हैं सोसाइटी ऑफ साइकेट्रिक नर्सिंग बेंगलुरु, ट्रेन नर्सेस एसोसिएशन ऑफ इंडिया न्यू दिल्ली, सोसाइटी ऑफ मिडवाइफ इन इंडिया, नर्सिंग रिसर्च सोसाइटी ऑफ इंडिया, नेक एसोसर बैंगलोर, interview panel member of Gujarat, Public Service Commission recruitment of nurses in Gujarat, editorial member in various journals, MP State Secretary of Nursing Teacher Association of India तथा PhD guide भी हैं। Now I am inviting Professor Dr. MS Vinci ma'am. Welcome ma'am.
Thank you ma'am for such a wonderful introduction. Good morning to all the participants who have joined this live webinar. Before addressing my topic, I first of all express my sincere gratitude to the management of Mansarovar University, and I express my thanks to the Dean of Nursing Institutes, Professor Dr. Chaya Philip ma'am, who have given me an opportunity to be a speaker of this live webinar. As the theme of this webinar is ANM, a changing role primarily from a midwife to a preventive health worker. Now, I would like to share a few things with my participants that when Madam had a talk with me, she told me that I have to address on the topic of ANM. So it sounds very interesting to me that I have to address on ANM. And I was expecting Madam like that. Madam will say like you have to address about hospital staff nurses or what preventive strategies we are doing regarding COVID-19 or its management. But she sounds me totally different. And it was like, Vinci, you have to speak on ANM regarding their role in society. And really, ma'am, your vision is totally different. And it helped me a lot because I worked on that topic and I came up with few slides. And even Government of India is giving more and more importance to ANM. So I will proceed with my slide shares. So participants, just give me a few seconds so that I can come back to my slide share. Is this visible to all the participants? Is it visible?
Your text.
Yeah.
Is it visible?
Yes.
Yeah. So I'm going to start my presentation. So again, I will be addressing on the topic's theme, that is ANM's changing role, primarily a midwife to preventive health worker. Now, it is very essential to understand about ANM and their services. To understand this thing, we have got three outlines. My presentation has got three outlines. The first outline is urge to include ANM in health organization pyramid. क्या ऐसी चीज है कि हमको ANM को लेके आना है हेल्थ ऑर्गेनाइजेशन पिरामिड में? So it is very essential to understand what is health organization pyramid and role of ANM in that pyramid. Then how the role of ANM got changed. The second outline is in this I have not written changed role. It's a changing role. It is going on changing. The role of ANM is going on changing. Primarily they were midwife, now they changed into preventive health worker. Then the third one is current services shouldered during COVID-19, which is the very current topic, but I will be dealing at the last. So This is just an overview. I know the participants who have joined currently, they are all aware about what healthcare system we are having. But still, I would like to revise it. Like we have got 5 major sectors in India. First one is public health sector. Second one is private sector, indigenous system of medicine, voluntary health agencies, then national health programs. So when our focus is towards ANM, so I will be focusing on primary health care. And primary health care is then again consist of primary health centers and sub centers. So when we talk about this secondary and tertiary, it includes the hospitals. So you have to understand what is the difference between health centers and hospital. So health centers, when we talk about health centers, they have got a defined population. They are like they have given a restriction that you have to cover this much population, this much area, this much village. Whereas hospitals, they have got no such defined areas or population, and hospitals mainly focuses on curative aspect, whereas health centers, they focuses mainly on preventive, promotive and curative. So primary health centers, as I told, that health centers, when we say, they have got a defined population, so 30,000 population. But when we talk about hilly, tribal and backward areas, we proceed with 20,000 population. Now our next is sub-center. So sub-center in villages, the sub-center has got a population of 5,000. But when we talk about like hilly, tribal, backward areas, the population is 3,000. Now, I'm not focusing about primary health centers because I will get deviated from my topic, because my topic is ANM. So I will be focusing on sub-center services. So sub-center services, what all services they are providing to the villages are immunization, antenatal, postnatal, intranatal, prevention of malnutrition, family planning and counseling, medicines for minor ailments like ARI, acute respiratory infection, then diarrhea, fever, worm infestations, etc., and implementation of several national health and family welfare programs. Now, you might be thinking that there are so many services which we are providing at sub-center. So, who is going to provide? Because what we know about ANM is that when we talk about ANM, we say that they are meant for only MCH services. But when you will focus on this slide, the services are additional to MCH services. Now the staffing pattern at the sub-center. So because I said that I am focusing on ANM, and in sub-center, the role of ANM starts. So the staffing pattern shows one ANM who is a female health worker, one multi-purpose worker, male health worker, one voluntary health worker as a helper to ANM, and they are employed as when needed. Then two health assistants who are located at PSC, and the PSC has and they has to supervise 6 sub-centers. They are supervised by one lady health visitor. I will elaborate their role in detail just for just to understand or to have a background of healthcare system and how the bifurcation has been done and where the ANMs are being posted. That I want to highlight. So that's why I made this slide. Now, our main presentation outline was urged to include ANM in health organization pyramid and their role. हमें ऐसी क्या जरूरत पड़ी कि हमें ANM को इस हेल्थ केयर ऑर्गेनाइजेशन में लेके आना पड़ा. And now you have already seen कि क्या क्या activities हम सब सेंटर लेवल पे करते हैं. लेकिन to understand this, you have to understand what are the 3 cadres of community health workers. We have got 3 cadres of community health workers. First one at the top is the ANM, and the second one is Anganwadi workers. Third is accredited social health activists. They came in the year of 2005 by NRHM. Now, this auxiliary nurse midwife, you are all aware that as per INC norms and curriculums, council, they had made a 2-year course for ANM, and they get registration from State Nursing Council. That means they are professional nurses. Then Anganwadi, they cover a population of near about 400 to 500, whereas Asha workers, they cover a population of 1,000, and they focuses on promotion of MCH, including immunization, institutional based delivery for which they receive performance related fee. So you have to understand that what I have mentioned and what I have said. They focus on promotion. They are not conducting any deliveries. They are not going to conduct any giving immunizations. They are doing promotive activity. So who is overall responsible and accountable is the ANM. Now, the sub-center, which you have understood that it works under primary health center, and each primary health center has around 6 sub-centers. Now, before the launch of NRHM, now main our focus is that why there is need of ANM. In 2005, NRHM has thought that one ANM is sufficient for one sub-center. But later they have realized that no, the work which we are giving to ANM, it is something extreme, and they are doing multi-purpose role. It's not only that they are focusing on maternal and child health. So their demand has increased, and they felt that one ANM is not sufficient. So in 2005, they made another provision like two ANMs, one permanent and one contractual basis for each sub-center. And the last line says that the ANM is usually selected from the local village to increase accountability. Now, have you ever thought that why they are giving emphasis on this, that ANM is usually to be selected from local village? Because a layman person who is coming from outside, he may not be aware about the population's behavior, how they are going to deal with you and what they are expecting from you. But if the ANM is from the same village, she can understand their feelings, she can understand their needs, and the services which she will be delivering, it will be more effective in comparison to ANM who is coming from outside. Now, under NRHM, each sub-center gets a untitled fund for expenditure. The ANM has a joint bank account with the Sarpanch. So it's the credit for ANM, and hats off to ANM that they are dealing such a big thing. And ANM has using these funds for buying items which are required for purchasing, like blood pressure equipments, weighing machine, scales, and other items required for cleaning. So you can understand that their work is like multi-purpose role. So now what ANM work includes: maternal and child health, health and nutrition education, efforts for maintaining environmental sanitation, immunization for the control of communicable diseases, treatment of minor injuries, and first aid in emergencies and disaster. This disaster I have highlighted red. Now the participants who have joined this webinar, I will tell you after 2-3 slides that why I have highlighted is red. So participants, I have posted one pic of ANM. See that ANM, her pic itself shows that although she has got one bag, but that bag is carrying lot of responsibilities, and she carries that bag means she is accountable for those responsibilities. Now, changing role of the ANM. This is our second outline of our presentation. The first outline was what was the urge to add ANM in our healthcare system, and we have covered and we went to an overview of the healthcare system's background, that it has divided into 5 sectors, and they have got 3 cadres of community health workers, and how ANM's demand has increased based on the workload in village from 1 to 2. So now we will discuss about changing role of the ANM. So at the time when the ANM program has launched, I don't feel that anyone might have thought in the healthcare delivery system that what work they are planned and what it is going to be done. So they focused mainly on MCH. So they thought that because that was the need of that time, because of our mortality rate and many more issues were there. So they focused primarily on MCH, and midwifery being focused of 9 out of the 24 months of training, and they were considered as envisioned as village level midwives with less qualifications. But things got changed. So in early 1970s, the role of ANM was expanded to include a wide range of preventive and curative work at village level. So this is the transformation which I was discussing, like the role, how they changed from a primary midwife to a preventive health worker. So now she is not only handling MCH services, she is handling many other works which are related to preventive and curative at village level. That includes family planning, immunization, and many more. With the expansion of their role, ANMs transitioned from temporary to permanent staff. So it's a very big thing and a big applaud for ANM, because why they gained important, that too we have to understand. They were sincere in their work. So that's why government has thought that they should be given additional work. So hats off to all the ANMs. And at the same time, ANMs were also reclassified in the health system from a nurse midwife to a female multi-purpose worker. In Srivastava committee, they have called for improved ANM training. And today, when we talk about ANM, ANMs have improved a lot. The training pattern had improved a lot. They are given training by Indian Nursing Council, because various nursing colleges, nursing schools are there who are providing this training of 2 year. 2 year counts a lot, and they are being registered by State Nursing Council, so they have got an excellent standard. The National Rural Health Mission, which I have already told you that when they understood the role of ANM, they doubled it from 1 to 2. And this shows that they positioned a key health worker. Now, we are also talking about LHV. Now, who are LHV? LHVs are none other than ANM, but slightly they are different from ANM in terms of their experiences. LHVs are those ANMs who have got 5 years of work experience and who possess 6 months of training program. And these LHVs are responsible to supervise 6 sub-centers. So this is also a tremendous work which the LHVs are doing. Now, in the starting slides, when I was discussing about the multi-purpose role which is being performed by ANM, in that I had highlighted disaster. And everyone, I think not only of MP, of whole India as well as the world is aware that we are currently facing bio disaster which is caused by coronavirus, that is COVID-19. So the question comes to our mind that what happens at our grassroots level? See, when I am attending various webinars, even in my college, various webinars were being organized, and our focus was mainly towards nurses who are working at hospital side, doctors who are working at hospital side. We were focusing on donning, doffing. We were giving big salutes to the nurses who were working in COVID-19 designated hospitals. But have we ever thought that other than these secondary and tertiary care centers, what about our primary health centers? Primary health centers also got affected because in COVID-19, many restrictions came. So how the community people gained knowledge, how the screening was done at community level, who were the people, because there is shortage of registered nurses even at hospital level. So what is about our condition at rural level? What about our condition at grassroots level? So we are lucky to have ANMs. So these are the things which government of India had already planned when we underwent this disaster. That was, they have introduced various learning resource packages. This is one sample which is given by Indian Nursing Council, and Ministry of Family Health Welfare has also given various guidebooks, various modules to the ANM health workers, and they are trained for the prevention of COVID-19, and their work responsibility is very high in COVID-19. Now, after undergoing these training modules, what the ANMs will be able to do, that they are very much clear in defining COVID-19. They can very well understand the symptoms and signs of COVID-19, and they can very well explain preventive measures by health personnel and people from getting infected. And they work as a coordinator between ASHA and Anganwadi workers. So they educate the community regarding COVID-19, its prevention, self-protection, and informing ASHA or Anganwadi workers each symptom arises. So she is doing a tremendous job even at grassroots level. Then she coordinates with ASHAs and Anganwadi workers to link suspected person with healthcare facility for confirmation and care. That is the most important task. That means she is also exposed to COVID-19 patients who are there in the community. So ASHA workers, Anganwadi workers, she has to coordinate with them. She has to identify, she has to educate the ASHA workers, Anganwadi workers, and then they are bringing them to the hospital. And there the role of staff nurses starts of caring the COVID-19. But the grassroots level, if it is zero, then we can't stop community transmission and many more issues which we are having the fear how we will be going to handle. Now, role of ANM to control COVID-19. What role it is been allotted to ANM, how they can control COVID-19 in grassroots level, like villages. Be aware and alert of the key details and updates provided by Government of India. Educate the women and men coming to the health sub center and health and wellness center, like nowadays CHC, community health centers have been converted into health and wellness center, about COVID-19. Then do and don'ts to prevent the disease. Using the job aids, they have been given various guides, handbooks, and manuals. Then they coordinate with ashas of our area to create awareness about COVID-19 in the community by group meetings or during house-to-house visits using job aids. With ASHA, identifying patients with symptoms and link them to healthcare system for testing and caring. So again, she's doing a very, very important role. Then call state health care helpline or contact the number, the health facility regarding the details of the patient. Coordinate with the district surveillance officer to visit the patient for advice on next step. Keep record of the contacts of positive patients for isolation and symptoms. Keep record and report the positive cases for of her area. So really they are doing a big work, and I will show you that how their work were being appreciated by various news agencies, and they have highlighted in various sites. What had happened was mainly when we were talking about hospital areas, we were very much attentive. We were very much concerned that in hospital COVID-19 will come. So we have to sanitize the whole area. We have to go for all the PPE things so that we can protect our staff. But on the other side of the war, I will say, there were corona warriors, still they are there, who are relentlessly giving their services, how they can control, how they can manage the situation and to avoid the spreading of this corona, that is COVID-19. Now I will move to salute to corona warriors. When I was preparing this slide, I have collected various resource material, and I was so overthrilled and felt so much proud about ANMs, that what services they are doing. So the clap, which is this cartoon is doing, is not the clap simply going on. It is a clap from me as well as by the participants to all the ANM workers in the form of a salute what they have done. So this is an article which I got from one of the newspaper. In this it is mentioned that retired Odisha ANM donates her pension money for COVID-19. So superb. Kusum Lata Sahu, I feel proud today to take her name, and it gives me immense pleasure to say that Kusum Lata Sahu of Bhadrak district, one of the COVID-19 red zones in Odisha, on Thursday walked up to the Tehsil office in Dharmnagar area to hand over a check of rupees 50,000 as her donation to the Chief Minister's Relief Fund. So really, her job is highly appreciable. Then Indian Express dated 12th May 2020. This day is very important for all the nurses, because this was the day when we all were celebrating International Nurses Day. But when I read this article, it touched my heart, because it says that this is the words, the feelings which an auxiliary nurse midwife has shared, that though the typical work hours of an ANM and an LHV, now I know that you all understand what is ANM and LHV, are between 8 a.m. to 2 p.m. Most of these women often commute from afar and work late into the evening, maintaining registers and uploading data digitally at home. Why I have used the word commute from afar? Because there are no transport facilities, nothing, but so they have to walk a long distance to get all their data collect, to do their services during this COVID-19. And they are utilizing their evening time also to maintaining the registers and uploading the data digitally at home. So what one of the ANM says, a 32-year-old ANM expressed her feeling that one cannot see our work as merely a job. So this sentence carries a lot of weightage. One cannot see our work as merely a job, because the compensation is not enough to be lucrative. We have to accept our work as a form of social contribution. So this is the feeling which is being expressed by a 32-year-old auxiliary nurse midwife from the city of Mumbai who has been working on the frontline survey COVID-19 hotspots, often with minimal protective gear. Then this is my last slide, and in this I have taken one more article from the Financial Express, 5th April 2020. This article shows what is happening at the ground level, and it's a matter of concern. Like current coronavirus disease outbreak has been declared as pandemic by WHO, but WHO was very much concerned about one aspect, that was severely acute malnourished children. What will be their condition in an environment in which health and nutrition services are totally reduced, or I can say destroyed? The caring structures have been broken down within the society, and the trauma is prevalent and it is increasing. And above all, I will say the movement of the people is also restricted. These are the findings by Financial Express, that WHO, why they were so concerned, because definitely our healthcare system is shattered due to this COVID-19. So what will happen to this severely acute malnourished when our health nutrition services are destroyed, when there is restriction of movement? So what will be the challenges? Availability of supplement, nutrition, immunization, growth monitoring checkup. So these all things were a big challenge. Since the mortality is higher in severely acute malnourished children aged less than 24 months, these younger children are all the more vulnerable to the direct and indirect outcomes of this widespread pandemic. During this lockdown situation, the most important thing is to connect with their parents and family members. So who is the person? Who is the person who is going to connect with their parents and family members? So here the answer comes. They are our three cadres of community health workers. So we are fortunate to have three cadres of community health workers. I will say corona warriors. They are ANM, Anganwadi workers, ASHA workers, who were having mobile contacts with these families, are, and still they are in connection with these families. Because when I had a talk with one of the ANM worker, I asked her, what about your services? Are it get halted somewhere due to this COVID-19? They said no. They are having all mobile contacts. They are informing the family members. The date of the immunization is being informed to them, and they are given a particular time to prevent overcrowding. At this time only they will come, and they are giving their services, even food packs, which the governments are providing. That too they are distributing by calling them, rather than creating a crowd and all this. They are having mobiles, and they are connecting, getting connected with the family members. So really we are fortunate that we are blessed to have ANM, Anganwadi workers, ASHA workers at our grassroots level. And before winding up my slide, we always used to say that our staff nurses who are working in hospital, they have to cover general ward, or suppose they have to cover 24 patients, and they have to supervise this particular area or ICU or ward. And we have got a proper like organogram. At the top we have got nursing superintendent, then matron, assistant matron, then ward in charges, then supervisors, then staff nurses. But when we talk about ANM, have you ever thought that she is managing 5,000 population? 5,000 population. So I feel that they are the matron, they are the nursing superintendent, they are the assistant matron, they are the ward in charge, they are the staff nurse. The whole multi-purpose role she is managing at the grassroots level. So once again, I salute ANM workers, corona warriors, and I believe that they will protect us from community transmission. With this, I bring an end to my presentation, and I hand over to the Mansarovar group, Professor Dr. Chaya ma'am, and the session can be made open for the participants for their queries. Ma'am, if the participants are interested, they can have their queries with me. Ma'am, the presentation was okay for you?
Yeah, ma'am.
I tried my level best.
It was a lovely session.
Thank you, sir.
There is a one question. There is a somebody raised the hand. Miss Marine, you can speak. Miss Marine, you there? She's not there, I guess. Uh, Mrs. Sheetal Patel, you can speak. Sheetal ji? No, no one is responding right now.
Okay, sir.
One more. Himanshu Anand.
Yeah.
Himanshu Anand, you can ask your question. Please unmute. Himanshu Anand, you need to unmute, sir. No one will. Yes.
No questions.
No questions as such.
Yeah, ma'am. I can't hear your voice. Hello?
Hello. Hanji
Yeah,
ma'am.
yeah, ma'am.
Yeah.
I can see in that chat, madam's one message is there. One person has inquired about that. It is from Oppo F11 Pro. I can see. He had written that how does the virus spread? So I will address this question. Now it is very everywhere the information is given, and the best I will give you the answer. But the best answer will be you just make a call to your one of your best friend, and as soon as you will make a call, your mobile itself will give you the answer. खांसने से ये फैलता है, छींकने से. So the answer is that when you are coughing, you are sneezing, the virus will come in contact with another person who is very close, and when that person will inhale that droplets which is in the air, and if the friend person who is infected with this COVID, the person is not infected, that non-infected will inhale, so definitely he will get that virus. Second thing is that that infected person will do handshaking with you, then also the virus will get transmitted, and sharing his utensils if it is not properly clean. So there are many things, and social distancing, these all things you have to maintain, regular hand washing, because you are not aware who is COVID-19, because there are symptomatic, asymptomatic people. So there are various things by which the virus can spread, and you can go through various sites and your doubts, like one Himanshu Anand is asking a question. So there are various sites from where you can get knowledge that how it is going to spread, and these are the common things, and still the research is going on. The things which everyone is aware, which the WHO has said, that I have informed you.
Ma'am, there is a question by Manju Botham.
Yeah.
What would the new strategies to people to live with this virus?
See, the first thing is that one thing we are having is fear. Everyone, like those who are going out for their job, you just have an interaction. What we have observed is that the first day they will say, I'm very panic, how I am going to work in, how I am going to move out of my house, where I have to touch. Every time I have to wash with I have to wash my hand, or I have to use hand sanitizer. If I open the door of the car, then again I have to use hand sanitizer. If I have to sit inside, again I have to use. So this is actually a fear. You have to understand what actually this COVID-19 is. You have to boost up your immunity. If you want to stay protected, you have to follow all the norms which WHO is saying, which our ICMR is saying, like social distancing, preventing handshaking, then always wear mask when you are going out, using hand sanitizers. So these are the preventive strategies. So you have to be very strong in your mind itself, that you have to use all the preventive strategies. Then you have to be very strong mentally. Physically, you boost up your immunity, and the fear regarding COVID-19, that you have to overcome that fear. and you have to come out from your house. You have to carry out your activities when the lockdown will be over. Unnecessary moving out is not at all okay, but still, if there is a requirement, by having the fear that I will never come out of my house because corona is there, corona will reach to your house if you are not maintaining a social distance with your milkman, vegetable sellers, and other hawkers. So the best thing is that follow all the preventive strategies. You will be safe, and if you suffer also, so instead of getting panic, as soon as the first symptoms arise, immediately reach to the hospital. You will get treated and you will recover. So you have to move with a positive. You have to be optimistic rather than thinking all the time pessimistic that now what is going to happen to me and whether I will be going to survive or not. So you have to continue because this is a seasonal flu. Till the vaccines are not developed, we have to accept that COVID-19 is a part of your life.
Yeah. There is one more question by Manshu Anand.
Yeah.
If a pregnant lady of a suspected coronavirus,
Mm-hmm.
then firstly delivery or firstly coronavirus test?
Pardon, pardon.
If a pregnant lady is suspected of coronavirus,
Mm-hmm.
is trying to ask what will be the first thing we'll do. We'll do the delivery or we'll check the corona. We'll do the corona test.
Definitely, we will do the corona test because when we go for institutional deliveries, but we will not wait for the report. By seeing the suspected symptoms, we got the, because what happening in hospitals, even I am in hospital, what we are seeing is that when the patients are coming, the screening is done, and we get an idea that yes, they are showing the sign and symptoms. Our OT members, they are using all the PP, because see sometimes what happened that after OT, after 2-3 days we come to know that okay, this patient is COVID-19. So at that time, rather than making crying and all these, "Are हमने तो ध्यान ही नहीं दिया, हमें तो पता ही नहीं." So no one can say that whether this person is COVID-19 or not. So the best thing is that you follow all PPE rules and consider each person who is coming to your hospital that he may be a suspect of COVID-19.
It's an anonymous attendee. Rapid testing kit is better or RT-PCR technique is better?
That I can't comment because that can be suggested by a lab people that which one will be better. That I can't comment.
Lockdown is the only cure left to overcome from COVID-19?
No. Because when we talk about economical things, we can't go with lockdown for a longer period. Because economics is also a very essential part of a nation's progress. So lockdown is not the only cure. You have to cope up. See, lockdown means you are not going out. So remaining in your home itself, how you can give the guarantee that you are not going to get infected with COVID-19 if you are not following any of the preventive strategies. So you have to follow the preventive strategies. Even though the lockdown has been erased out, you have to follow the preventive strategies. If you want to safeguard, it is not the duty of the government that they are going to safeguard you, they are going to give you. You have to safeguard of your own life rather than depending on government. So lockdown is not only the cure. Because in many countries, like in US and other countries, they are not following lockdown policies. So it's not like that you have to follow lockdown and it will be the only cure. If lockdown will continue forever, then you may not die of COVID-19, but you may die of hunger and economic recession.
Rajni Shikha
Yeah,
is asking.
I can see what she has asked is, ma'am, agar pregnant mother is coronavirus positive, तो क्या birth होगा? Yes, she will deliver the baby and she will not be rejected by the hospital. The delivery will be conducted. The only thing is that the doctors who are in OT, the nurses, they always follow the protocol of PPE, because in our hospital, I have seen that one patient was shifted to OT, and what it has been observed is that after the surgery, they came to the conclusion that he is COVID-19. But nothing happened to our staff because they all followed PPE. And the lady, if she delivers a baby, it never says that the baby will also have COVID-19. It's not like that. So she can deliver.
Ma'am, can coronavirus travel through placenta?
I can see one question, and that sounds very interesting, that, ma'am, what about the medicine and vaccines that can protect us from this virus? So this question is very interesting. because if I know the medicine and the vaccine, so I will be the first person who would have taken. But till now, the medicine and the vaccines are not in the market, which can give you assurity that it can protect you from the virus.
Manju Bottom is asking what we do if someone body temperature is up and down in thermal screening.
Mhm.
What measure we have to take up in the condition? Variable
Can
temperature.
you can you address the question again?
What we do if someone body temperature is up and down in the thermal scanning?
So they
What?
will not be allowed to travel because thermal scanning people used to prefer when they are going to travel some one place to another, or they want to enter some particular hospital or something like that. So definitely they will go for COVID-19 test. And first thing is that majority hospitals and majority places have got like screenings, fever clinic is there, and they used to do the screening. And other symptoms are also there. For example, there might be a child who might be having throat infection due to some other reason, and the temperature may be very high, but during the screening process itself doctors identify and they feel, then they will suggest for COVID-19 test. Otherwise they can go with a regular treatment also.
I can see the rest of the questions, whichever are there, you already
Mhm.
answered most of them.
Yeah, yeah,
मेरा
I can see
सवाल तो
also.
एक ही है.
And one common question what I can see is that regarding transmission of like coronavirus from animal source. So it's not like that. Animal sources are even in the newspaper, today's newspaper also, it has been highlighted that it is not transmitted by the animals. But when it started, coronavirus, when it had started, still the things are under study that how it got transmitted. Secondary transmission is there through animals.
And we have Priyanka Shivhare over here.
Yeah, yeah.
Priyanka, go ahead, ask your question, please.
Hello.
Priyanka?
Hi,
Yes.
Priyanka.
Hello, ma'am.
Yeah, I can hear your voice. Hello. Raise your question.
Actually, ma'am, during this situation, most
Mhm.
probably,
Speak loudly. Your voice is not that much audible to you. Audible to me.
ma'am, can you listen to me?
Go
Tell
ahead, go
me.
ahead.
Hello.
Yeah, I can hear.
Yes, ma'am. When baby is delivered,
Mhm.
and most probably baby also positive in COVID-19, ma'am.
No, no.
If
It's
uh,
not
if
like.
uh, if mother is positive, so baby also positive,
No, that is not like that.
ma'am. But the mother also survived that this COVID-19 condition,
See, baby is
coronavirus.
protected inside the womb. Okay.
Okay.
So, mother is exposed to COVID-19. She is taking the treatment, and baby is inside the womb, and there the baby is free from all the infections. Okay. So, once the baby is delivered, it comes into a sterile world. It is not in an unhygienic world. And you have seen that in various COVID-19 centers, as soon as the baby is delivered out, a baby is handed over to the staff nurses and they are taking care of the baby. And the
Okay.
mother is not allowed to meet that baby.
Okay, ma'am.
Okay,
Ma'am,
so
if
the baby is protected. So no need to worry.
okay, ma'am. Thank you, ma'am.
Thank you for your question, dear.
We have Gulam Ahmad Raza.
Yeah.
Mr. Gulam, you can go ahead with your question. Mr. Gulam Ahmad, I guess he's not there.
I can see one person that is Anushri Vishwakarma. He has asked that how nurse can protect ourselves. So nurse, for nurses as well as for doctors and for the healthcare professionals who are working in hospitals as well as in primary health centers, they are being given PPE and they get a separate training of how to wear, how to remove. So they are protected from COVID-19 coronavirus.
Dushyant Sharma.
Yeah, Dushyant.
Dushyant, you can ask your question. Okay. Nivedita Mishra is asking, will coronavirus affect the body of a pregnant lady? It's almost the same question, I guess. And
Same,
if
same.
it
We
is
have
it,
answered.
then will longer symptoms are to the it's almost the same questions we
Yeah,
are
yeah.
right. Dushyan Sharma has already asked on the Q&A. Ms. Ravi, how to
This
reduce?
I would like to answer.
Yeah.
It's from Dushyant Sharma, and his question is interesting also. How to reduce fear of COVID-19 among nurses, and how nurses can create a positive attitude for the same in the patients. Dushyant, your question is really good. The reason is that being a nurse, we too have fear when we first heard about COVID-19, because the thing is that we are human beings, and this COVID-19, none of the person was familiar with this disease, so everyone was panicked. Even you might be heard that many doctors, they left their job, who were on contractual. Many nurses, they looked from their services. Many nurses resigned, many doctors resigned, and there were various shift changes you can observe in the behavior of the healthcare professionals as soon as they heard about COVID-19 patients getting admitted in hospitals. So yes, they were having fear, but when you encounter this fear repeatedly, you automatically develop a self-defense, and your defense mechanism becomes very strong, because you see that few of your nurses, they are very strong and they are coping with certain situations, and then you realizes that yes, why can't me? So the most important thing is that optimistic thought, that yes, I can, and I have to take care of this patient. If no one is there, then what will happen to this patient? So that type of things when comes to your mind, and the surroundings, when our healthy members, they are all supportive, they come up, they support us. When some relaxation, go and listen to the music, relax yourself. These all things are in words, but in practical grounds these are different, because it's not only about taking care of the patient. After taking care of the patient, you can't go and meet your family members. Again, a psychological trauma. Your family members might be waiting in your house, but you are not supposed to meet them. Even though your quarantine period is over, when you are going back, then also before entering into your house, doing hand washing, entering, then taking bath, keeping yourself isolated, these all things create a big trauma in your mind. So you have to be, in all that period, you have to be very, very optimistic, that yes, I can do, and I have to do, and I will overcome. And a day will come when you automatically feel, because the same thing happened to us also. But when we started seeing other people, other nurses, other doctors, that they were very strong, and we opted their optimism, and nowadays we don't have the fear, because we adopt all the preventive strategies, and we made ourselves mentally very strong.
There is a question
Mhm.
by Sheetal Shah. Ma'am, can plasma treatment of blood donated by recovered patients of COVID help in the treatment? You can see on the chat
Yeah,
as
I
well.
have seen that plasma treatment of blood donated. See,
Hmm.
in this also there was a big discussion by doctors of AIMS and from other renowned hospitals. And I will not be a good person to comment on this, but what information I have gained is that if a person has got various comorbid diseases, then it will be difficult for a recovered person also to donate the plasma. It all depends upon the doctors that who are dealing with the patients, what they feel. And still the trials are going on. It is not a 100% treatment that yes, it will be useful and everyone can donate. So trial is going on, and it will not be good to comment on this, because still the things are not clear whether it is a successful thing or not.
Uh, will warm weather stop the outbreak of COVID-19?
No, because now our climate is going to change into rainy season, and still we have not overcome COVID-19. So the answer is given itself by the nature and coronavirus.
Mhm. How many hours we have to keep the vegetables or other things will deliver to house?
That I'm not an I am a nurse. I can't address on this.
Some, I guess, irrelevant questions that some are there.
Yeah, now the questions, what I feel is that it's a some simple questions, like a normal public can get the information from anywhere. So
Mm.
this is nothing related to nursing and something like that, I
And
guess.
in the chat box, Jyoti Joshi is
Jyoti
asking.
Joshi, yes, ma'am, children and older are at risk. Is there any special precautions? Yes, it has been shown. Even yesterday in the news also, it has been highlighted that their immunity is very weak. And when we talk about elders, they are always associated with, I can say 90% olders are associated with comorbid diseases. So it becomes very difficult for their recovery, and the survival chances are also very less. And for children, it becomes their immunity is very low. So it is the best thing is that they should remain in home. And you can understand by the government strategies also that they are delaying in opening the schools. So it shows that children can't be exposed immediately. And regarding elders, they are associated with comorbids, and everyone is aware that if they have got comorbid, then the recovery rate will be very poor. So that's why they have been said that stay in home and follow all the preventive measures, and they should be more stringent in following the preventive measures in comparison to others.
Feba is asking,
Mhm.
are we prevented by normal mask? What we get
No,
in?
no. See, we can't use N95 everywhere because there will be shortage of various things, because it is mainly required by hospital people because they are getting exposed to COVID-19. But if you are in a general place, you can use the normal mask. But normal has got again various definitions. It should not be a thin layered cloth. If it is a 3 layered cloth, it will work. But to prevent COVID-19, normal mask is not going to work out. You have to go with N95.
मैम ओप्पो जी पूछ रहे हैं ओप्पो जी
हाँ, Oppo जी.
मैम
Can we recover?
कैन या
वो तो ओप्पो जी की इम्यूनिटी पे ही डिपेंड करेगा कि वो रिकवर कर सकते हैं, बिकॉज इट वेरीज फ्रॉम पर्सन टू पर्सन रिगार्डिंग their immunity. There is no, say, I am not a god who can say yes, people can recover. And the best example is Bhopal itself, because the recovery rate of Bhopal in comparison to other hospitals as other places of all over India is considered to be the top. In many of the news channels, it has been highlighted that the cases, recovery cases of Bhopal is superb, means they are doing the best. So the answer is from Bhopal itself, the recovery rate of COVID-19 is superb.
ऑल मेरे ख्याल से सारे एक जैसे ही क्वेश्चन है
Yeah.
शोभा लाल ने पूछा शोभ लाल ने पूछा है मैम
Yeah.
COVID-19 will increase or decrease in rainy season.
See, I can't give any assurity that it is going. There is nothing related to climate interaction with COVID-19. Previously, people commented that if the temperature is very high, then the coronavirus is going to die. Nothing is found to be relevant to that. And one more thing I would like to address is that if you are coming in contact, the whole thing comes again back to that storyline that if you are coming in contact and if you are not following any preventive strategies, you are going to get infected with coronavirus. So we shouldn't focus on this weather, that rainy winter or warm climate or so and so. The thing is that no one is there who have still proved that this weather will save us from coronavirus.
पीपी किट के लिए सपना पूछ रही हैं 100% सेफ है कि नहीं है.
Yeah, PP kit, see, PP kit never says that you are 100% safe. PP kit is like a preventive strategy. Safety is a different thing, prevention is a different thing. You are wearing, how you are wearing that PP kit, how you are removing that PP kit, and later on what strategies you have approached, everything depends, and then only I can say that you are safe. If you are following proper doffing policies, how to wear, how to remove, then after that also, even before that also, and then after removing all these, what all preventive strategies you have adopted, everything depends, and that will give you the guarantee regarding your safety. Safety is another thing. Preventive, these are the preventive equipments, I will say, against coronavirus. It's not any assurity of 100%.
An anonymous attendee is there. Does COVID-19 increase the risk of pregnancy complications?
Definitely, because the treatment is also there. So once the person is infected with COVID-19, he will undergo with lot of medications. So there are risks that it will lead to certain complications.
उन्होंने ही पूछा है कि गर्म चीजें खाने से
No. See, we have seen many people. If you are exposed to a COVID-19 and if you are not taking any preventive measures, then after eating any items, whether it is lukewarm, warm, it is not going to protect you.
I mean, few silly questions कि
Yes,
किसी
yes,
को
I
फैलाना है
feel
और दिख नहीं रहा है लेकिन वो फैला सकता है
it's
कि
not silly. I
I mean ये तो
it's
सबको पता है कि
curiosity. The curiosity that people are asking, because currently people like panic and they have got lot of queries. Even when we talk in public also, we can understand that बहुत बड़ी बात नहीं है, because we are exposed to this area, but a layman person is having lot of doubts.
हम्म Pooja Patel raised her hand. Pooja Patel ji, are you there? सारे क्वेश्चंस कवर हो गए हैं आई गेस.
Yeah, I also feel that the questions have been covered up. Okay, so shall we?
So, any more questions, ma'am?
Yeah. I hope, ma'am, that I tried to cover the things.
थैंक यू सो मच मैम फॉर सच अ नाइस सेशन. और मैं सोचती हूँ कि यहाँ जितने अटेंडीज हैं उनके लिए ये सेशन बहुत ही फ्रूटफुल होगा. सो थैंक यू सो मच फॉर जॉइनिंग अस. और मैं स्पेशल थैंक्स देना चाहती हूँ अब मानसरोवर ग्रुप के सीडी सर को, जिनके गाइडेंस एंड कोऑपरेशन से ही ये वेबिनार हो पाया है. और थैंक यू सो मच सर फॉर योर गाइडेंस एंड सपोर्ट. थैंक यू मैम.